So, hi everyone, today we are going to talk about evidence-based practice in physiotherapy, EBPT. So, what is the EBPT? The EBPT is defined as physiotherapy informed by relevant high-quality clinical research. So if you are thinking to use the ABPT in your clinical intervention, in your clinical life, so you have to consider three different aspects. The first one, so it's really important, you have to know the technique, you have to know the method that you're going to use in your patient. So the clinical expertise is really important. The second one is the best research evidence. So if you are thinking to treat some specific disease and specific disability, you have to know, you have to use the best evidence. So the best intervention in some specific disease. And in addition, you have to consider the preference and value of your patients. So if you consider these three different points, you are using the ABPT in your clinical practice. So how we can apply the ABPT in our real life? So we have five different points, five different steps. I want to show you each one. So the first one is clinical question. The second one is search. You have to apprise the evidence and integrate this new knowledge in your clinical practice. And finally, you have to evaluate. So the first one, the clinical question. For example, if you are working with Pilates or some kind of this exercise and you are thinking to use this method, this exercise in patient with a stroke, for example, probably your question could be, could we use Pilates in patient with a stroke, for example? Or probably another question could be, what are the best intervention for patient with a stroke, or what is the best exercise to use in patient with COPD, or what is the best technique to use in back pain, for example. So it depends according to our clinical practice, our reality. So this is the first point, clinical question. If you have a good clinical question, you can go to the second step. So you have to put some keywords in this database. We have a lot of database, so I highly recommend PubMed or Cielo. And you can put here, for example, some keywords and look for the best evidence. Here in this pyramid, we have the best evidence on the top. So we have the systematic review and meta-analysis and the randomized clinical trial here. Okay. So if you are looking for example, something related with Pilates or stroke, you have to put this keyword on this database and look for systematic review, meta-analysis, or randomized clinical trials in this area, and you can use an intervention with high evidence. So the third step, you have to apprise the evidence. So if you check and you were able to find some good paper, for example, a meta-analysis in this area, you have to read this and analyze this study. For example, we have the conclusion here that Pilates could improve the balance and walking speed in stroke patients. So we can use Pilates in patients with a stroke according to this meta-analysis. However, this is not the best intervention in this kind of patient, but if you are thinking to improve and use something different to improve balance and walking speed, you can use Pilates in this patient. So this is really important. And the other point, you have to integrate this knowledge in your real life. So you have to talk with your colleagues and patients about this technique, about the evidence, and you have to ask as well your patient if they want to do that. And you have to apply this methodology, this exercise, for example. Finally, The other pain is the evaluation. So you have to measure what was the effect of your intervention in the patient, and if this patient improved and how much they improve in the different outcomes. And you have to check your results. And this is important because you can even compare with the literature. And if this is something new, for example, if you have a new finding for the literature, even you can write this result and publish this in one paper. Okay, so it's really important to use the ABPT if you are thinking to work on research or if you are thinking to work on clinical practice. So I'm gonna read one quote for you. So the evidence alone is never sufficient to make a clinical decision. So you have to consider this. You have to consider the 3 points to talk about ABPT in your clinical life. If you are working on research, or if you are working just in the clinical practice. So thank you very much. Have a good week.